surge of COVID-19 cases over in the nation's second city. Good morning, everyone. I'm LaDawn Davis, and this is the Morning Edition. Thank you so much for tuning in. The confirmed figures for COVID-19 still high for Grand Bahama, with 39 new cases recorded on Monday alone. This pushes that island's COVID-19 numbers to 428. As residents remain in an extended lockdown, New Providence saw 3 new cases on Monday for a total of 420. Overall, the COVID figures are just shy of 1,000 at 945. The latest COVID-19 victim is said to be a 34-year-old male of New Providence. He died on August 6th, but health officials say investigations are being conducted into this latest death. The total COVID-19 deaths now stand at 15. Health officials questioned about the COVID-19 mortality rate in this country. Deputy Chief Medical Officer Dr. DeLon Brennan speaks to the issue with Lloyd Allen.
When we look at the data so far, our mortality is pretty similar. It's actually a little bit lower than we've seen in some of the more hard-hit areas, but it's comparable to what we're seeing in our neighbors within the Caribbean. So far, that has not posed a big challenge. But we do know that that could change at any moment. We expect that with this higher number of cases and the number of people who've been hospitalized and those who are requiring intensive care, that unfortunately we will likely see additional cases of death, and so we do have to be prepared for that.
Also on Sunday, the Prime Minister referred to case numbers in Grand Bahama as grave. What constitutes status death when compared to New Providence?
I think when you compare just the population and sizes, Grand Bahama represents about 15% of the population in the Bahamas, where New Providence represents about 70%. So if you just look at, yes, our raw numbers are pretty similar, but compared to the total number of people on the island, they have a higher per capita rate of infection than New Providence does.
From your perspective, how long before we can see an end to restriction measures like lockdowns and curfews?
I think we're going to be in this for at least a few more months. I don't think it's necessarily going to be as restrictive that entire time. I think we look at the pattern that we saw in the first wave, where we had more restrictive measures at the very beginning, and then we were slowly able to open up. I think that same pattern happened. When we listened to the Prime Minister, we heard about the southern islands now being allowed to have more commerce and more movement than those islands in the central and northern Bahamas, because this is where the cases are concentrated. So I think we could look forward to lifting of some restrictions as the numbers improve. But if we continue to have the high rates and the spread within other islands, as we're now seeing more islands being involved, we are likely to continue restrictions on those islands until we have a better handle on the situation.